Welcome back. That was Melissa Cohn from MC Home Loans. You can reach her at 844-667-7300. Melissa knows everything there is to know about the mortgage business. And she, as I mentioned earlier, is a legend despite her incredible youth, vibrance, and good looks. Today we have a really interesting guest. I always talk about Twitter on the show. You can follow me at Rob M. Taub on Twitter. And you can follow Tony Simone on Twitter too, but email Tony at tsimone, Tsimone, at stribling.com. Our guest today is Dr. Neil Floch, who I met on Twitter, and we become friends. And he is the director of bariatric surgery at Norwalk Hospital. And he and I discuss type 2 diabetes, from which I sadly suffer. And our next guest from the New York Post, Steve Kuzo, also writes about that frequently. Welcome, Dr. Floch.
Well, it's a pleasure to be on with you, and I feel very welcome.
It's funny. I was looking at some of your tweets this morning, and I saw another tweet. Everything is the new smoking, and somebody tweeted out, eating badly is the new smoking. There's so much to talk about type 2 diabetes. I don't even know where to begin, but I'll dump that into your lap right now.
Well, yeah, I could, 13 minutes doesn't do justice to the food industry, and type 2 diabetes and the worldwide epidemic that is associated with the foods that we eat. And what is happening to really mankind right now. So it really is a pretty big topic. Well,
let me preface the whole thing by saying I've really gotten my diabetes under control. I manage it. I've lost over 60 pounds. I'm 60 years old. I have a 33-inch waist. I've really kept it in check. But at one point, I slowly became around 60 pounds overweight, which happened over a period of a few years. You gain 10 or 15 pounds a year for 4 years, and then suddenly you're bordering on morbid obesity. And I went to Duke University's Diet and Fitness Center, where I was treated, and I made many friends who are lifelong friends, and some of whom did not overcome their diabetes as easily as I did. Some of them got bariatric surgery, and it changed their life. So they did that in conjunction with a diet.
Yes, I mean, I think that, what you've just explained really kind of sums up the association of diabetes and obesity. And there was a study that just came out that I tweeted this morning on a few patients who were capable of getting rid of their diabetes by losing weight. And unfortunately, that study only extended for about 6 months. So we don't know what happens to those people like 5 years and 10 years from now. But some of the diabetes that people obtain by eating improperly, such as carbohydrates and poor foods and too many calories and bad fats, you can make that go away if you haven't had diabetes for a long time. You can make it go away by dieting and eating properly. Unfortunately, many patients cannot diet properly. And if you are 80 pounds overweight, really it is difficult to lose that weight and keep it off. And that statistic of being able to lose that weight and keep it off is about 5%. And there are many reasons behind that. And I don't know if we'll get into that today. But for those people who cannot diet, bariatric surgery, although it sounds very dramatic to a lot of people, it really succeeds in keeping weight off in about 70% of patients.
Well, what drew me to you and what I found unique about you is that you not only do bariatric surgery, but you also talk about proper diet. I'll use it as an example. Rex Ryan, when he first got his bariatric surgery, he was still eating badly. He even said he just ate less bad food, but he was still eating pizza constantly. And I think a lot of surgeons will just give you the surgery and then say, okay, good, you're okay. And what I found unique about you is that's not the case at all.
Well, what I'm trying to teach the public about bariatric surgery is that bariatric surgeons are physicians that also do bariatric surgery. So we are talking about eating properly and exercising. And I can't speak for every bariatric surgeon, but you must stress those things as well as the surgery. And some surgeons do it differently. They'll have a whole program where there are other people who will actually talk about the nutrition and the exercise, et cetera. But there are surgeons such as myself that really talk and stress about everything at the same time. So you can't have the surgery thinking that you can go and eat the way that you did before, because we all eat improperly. I did. I was, I know what it's like to drink two large Cokes that are, a total of 2 liters a day. I used to do that as a kid growing up, and really we're pretty uneducated. So you've got to think of bariatric surgery as a really, really powerful tool, and that's what it is. It's a tool in addition to dieting. And dieting is eating a proper diet, I should say. That's different than dieting. You must eat a proper diet and stay on it. And exercise is really also a tool to be healthy. It's not a weight loss tool that many people think. When we talk about diet and exercise, it's the reduction of calories, the changing to higher quality foods, which is important too, because a calorie of one type of food is not equal to a calorie of another type of food. So, together, these 3 things are important for losing weight and getting rid of your diabetes. Now, there's one other point that is so important, and I know we only have a limited amount of time. The surgery itself does things to the body that weight loss does not do with dieting. So bariatric surgery alters the human body in such a way and does dramatic things to the body. And they are, number one, altering the gut or intestinal hormones, not hormones like sex hormones. They're body hormones. They're the 2 most well-known are something called ghrelin and leptin. And there's another hormone that gets talked about less so. It's called PYY. And these hormones are influenced by after the surgery, and they're changed. Another thing that happens is bile acids. We're finding the amount of bile acid is increased in your body, the blood level of bile acids, and that they indirectly change bacteria in your intestine, and they do other things as well. Now, the intestinal bacteria is the third thing that I'm going to mention. The microbiome, and everybody's hearing a lot about bacteria and the bacteria in your intestine. They dramatically change after gastric bypass surgery and sleeve gastrectomy surgery. So what we're learning about that is incredible. And there's one specific bacteria that is altered in diabetics after the surgery. So when you think about what tends to happen, people have a bias against the surgery, and they think that, the surgery is just a tool to lose weight. Well, it actually does dramatic things to the body to help people to lose weight, keep it off, and alter medical problems. The most important one and the most significant one that we know about, and it helps the most, is type 2 diabetes. And in fact, it actually helps type 1 diabetes as well, which is amazing in of itself.
Well, I had been pessimistic about bariatric surgery, and then one of my close friends that I met at Duke's Diet and Fitness Center, who was very diligent about managing his diet, and he still had trouble losing weight, and got the surgery, and it changed his entire life. And he's like a completely different and better and happier person. And that was enough for me right there. I just see a new human being who is able to travel and enjoy life, and just looks like the epitome of good health now.
Yeah, it's nothing is a magic pill. Everything takes work. But I must ask you, did your friend's diabetes not resolve after he lost weight?
He wasn't even a diabetic. I think he was just dealing with obesity, because Duke covers a lot of different areas. I mean, I specifically went there for diabetes, but there are a lot of people there who deal entirely with obesity. And it's remarkable, because you can meet somebody there who's 600 pounds and doesn't even have type 2 diabetes, but obviously they're going to have a lot of other issues because of problems with their weight. But as you said, there's no magic pill. I think that's my biggest issue with so many advertisements I see regarding diet and weight loss is, I wish one of these pop-up ads would be that simple. Take this vitamin and you're going to be fine. In 30 days, you'll lose 60 pounds and your diabetes. It's not going to happen. If it was possible, then there would be no overweight people. There's no miracle cure.
Yeah, the issue at hand is that we wouldn't need to do bariatric surgery. And the goal is, as a surgeon, as a doctor, our goal is to not only treat people for medical problems, but it's our responsibility to try to solve the medical problem. So it's my goal to eventually, and surgeons' goal, to not have to do this surgery. Let's learn from the surgery, figure out ways in which the surgery works, and apply them to different types of treatment. So, in thinking of that, if we could change the bacteria in the intestine so that would help people's diabetes, which we know that it can, and we can treat people in such a way, it opens up many different avenues that we can help people without operating on them. So when we keep open-minded and learn about the different ways in which the bacteria are changed, or the bile is altered, or the hormones are changed, I think we can really possibly address and help more people. So bariatric surgery is not just operating on people and a quick fix, and that's something that I try to teach people about on Twitter with a lot of the articles and medical evidence. Now,
speaking of Twitter, let me give you a Twitter plug. If you want to follow Dr. Floch on Twitter, it's at NEILFLOCHMD on Twitter, and he's really worth following. I learn a lot. There's always, in fact, I have a list of just everything you've published and written here. I got a hernia carrying it into the studio, so I'm gonna have to see a doctor about that. But you really have a substantial background in curriculum vitae. Is very impressive. Is there a website we should send people to?
Well, my website, Fairfield County Bariatrics, is endtheweight.com. So we do believe in all sorts of treatments, whether they're, first starting with a nutritionist, then there are medications that we can give patients. The balloon is the device we use, and then bariatric surgeries such as the sleeve gastrectomy, the gastric bypass. So endtheweight.com is easy to remember because you want to end your weight at what it is. So endtheweight.com is where we send people. And the website, you can sign up for a seminar, give free seminars, and educate people. And, I want people to be ready for surgery. We don't want to push them into it if they're not ready.
Well,
so many of our patients come, they listen, they send a family member in, or they come back years later, actually, and have surgery as well. So.
Well, I think that I've learned a lot. We'll have you on again soon. This was really informative and important to me as a diabetic because I want to get the word out to people. And you can lose the weight, and there are numerous ways to do it, and one of them is to learn about this and listen to people like Dr. Floch. Thanks so much for joining us, and we'll have you on again soon.
Rob, it's been really a pleasure, and I'd love to come back soon.
Okay, bye.